I thank Senator Markey for his tireless work on this issue and for joining us here this morning. And we are very fortunate that the Senator and all his colleagues in the New England delegation have taken a lead role in tackling this issue in the United States Congress. We're also fortunate here in New England that all 6 of our region's governors have taken action in each of their states to combat addiction, including our next guest, New Hampshire Governor Maggie Hassan. Under the governor's leadership, the Granite State has taken a multi-pronged approach to both prevent addiction and to provide appropriate treatment to those in need. Earlier this year, she appointed the Granite State's first Senior Director of Substance Abuse and Behavioral Health, essentially a state drug czar, to coordinate the state's efforts to combat heroin and prescription drug abuse. As a result, the state is now in the process of implementing 22 strategic recommendations, ranging from expanded access to substance abuse treatment to increased awareness and education efforts. The governor has also partnered with Boston University School of Medicine and the New England High-Intensity Drug Trafficking Area Program to host a series of educational conferences intended to help stem the tide of addiction by improving provider training. The first of these conferences will be held this Friday in Bedford, New Hampshire. We're pleased she could join us this morning to tell us more about New Hampshire's effort to combat the epidemic. Please join me in welcoming a very good friend of the New England Council, the Honorable Governor of the great state of New Hampshire, Maggie Hassan.
Well, good morning, everyone, and thank you, Jim Brett and the New England Council for hosting us today. I know you will be joined with my colleague, Charlie Baker, later on this morning, and I am grateful for his work on this issue as well. It was great to hear from Senator Markey and all the things he's leading on to help us combat this crisis. And to all of today's panelists, both private and public sector, thank you for being here and thank you for your work on this incredibly pressing issue. As you all know, the heroin and opioid crisis is the most pressing public health and public safety challenge facing our region. I think Senator Markey did a great job laying out that connection. Across New England, people are dying from the heroin and opioid crisis. At least 258 of our family, friends, and neighbors already this year in New Hampshire alone. And many more have overdosed, their lives saved only by the quick action of first responders, medical providers, and their family and friends. Everywhere I go, I hear from people who've been affected by substance abuse. It touches people from all walks of life. It touches businesses, it touches the workforce, it touches our young people, it touches people rich and poor, well-connected and not. This truly is an all-hands-on-deck moment, and we all need to work together every single day on a comprehensive approach in order to stem this tide and then reverse it. At the federal level, Senator Markey and our senior senator in New Hampshire, Senator Shaheen, are leaders in fighting for more resources for our region to combat substance abuse. As a region, our law enforcement officials work together every day with our federal partners at the DEA to address the supply side of the issue. Thanks to their collaboration, we have seen significant success in arresting drug dealers and seizing illegal drugs. And last summer, my fellow New England governors and I announced a regional collaboration focused in particular on a more efficient prescription drug monitoring process and facilitating data sharing, the kind of data sharing that Senator Markey was referencing. But we know that the fight against addiction is ongoing, and we must constantly be working to strengthen our efforts to combat the heroin and opioid crisis, not only at the federal and regional levels, but also as individual states and in our individual communities. Like Governor Patrick before, Governor Baker has demonstrated great leadership in efforts to combat this crisis. Both Governor Baker and I are, in fact, roiling the waters a bit with some of the changes that we are pushing for. But even if that change is difficult for some, I know that we're both going to keep pushing people, even if they are uncomfortable, because we need to make significant changes to combat this crisis. In New Hampshire, we've taken a number of important steps. Last month, we announced 2 grants to support law enforcement and other first responders on the front lines. And in our fiscally responsible budget compromise, we added 2 additional state police detectives to help combat the opioid crisis. While we will continue to look for additional creative ways we can make more resources available to support law enforcement, we all agree that we cannot arrest our way out of this problem. That's why we also continue our efforts to increase the safe and effective use of Narcan, a life-saving treatment that can reverse the effects of an opioid overdose. We must do everything we can to save lives in the event of an overdose, and we have to stop the supply of these dangerous drugs entering our region. But it is absolutely critical that we address the demand side of the issue as well. That's why our comprehensive approach must also focus on strengthening prevention, treatment, and recovery efforts. Our bipartisan healthcare expansion program has helped thousands of Granite Staters access substance abuse and mental health services since coverage began in August of 2014. In addition, we continue working to improve our prescription drug monitoring program. Earlier this year, I signed bipartisan legislation that strengthens the program and facilitates data sharing with other states, building on the important collaboration between New England governors. And we recently announced that the New Hampshire Department of Health and Human Services will revise the rules around bedroom size requirements for residential treatment centers. That will help alleviate some of the logistical roadblocks for expanding access to treatment. We also know that this crisis stems, at least in part, from the overuse, misuse, and abuse of addictive prescription opioids. And just to give folks a sense of the impact of that as well, if you talk with DEA officials, they will tell you that drug cartels target states that are outliers on prescription practices. So it's not a coincidence that if you are issuing a high number of prescriptions, you see drug dealers working their way into your state. I saw this firsthand when I visited Phoenix House in Dublin, New Hampshire 2 weeks ago. Many of the residents told me that their addiction began when they were prescribed opioids, often large doses, for routine procedures such as having dental work done. So to help prevent the overprescribing of opioids that can lead to addiction and heroin use, we're bringing a nationally recognized provider training program through the Boston University School of Medicine to New Hampshire. We are also working with physicians and patients across our state to develop stronger, more explicit, and more up-to-date rules on the prescribing of opioids. Last week, the New Hampshire Board of Medicine adopted a set of emergency rules, important reforms that include requiring a detailed informed consent form and eliminating an outdated reference in the previous rules to a statement that said that opioids aren't really addictive. And we are going to continue working together and pushing for additional reforms. But we still have much more work left to do in New Hampshire and across our region to save lives and to reverse the tide of addiction. We must act now with comprehensive action to help those addicted recover, to help prevent new addictions, and to help first responders and others fighting on the front lines of this crisis. That's why I and a bipartisan majority of New Hampshire's Executive Council have called the legislature back into special session on November 18th to consider comprehensive legislation to combat our opioid crisis, allowing for a full public process. There is strong bipartisan support for many of the measures we are proposing, measures that will give patients, providers, parents, and law enforcement better tools to combat this epidemic. This includes cracking down on fentanyl, which has been the major cause of overdose deaths in 2015 and is more lethal than heroin. A bill on fentanyl has already passed the Massachusetts House of Representatives, and we know that we need to bring the laws and penalties in New Hampshire for the distribution and sale of fentanyl in line with those for heroin. We agree that we need to develop a statewide drug court plan to expand existing drug courts and establish new ones across our state. We know that we need to strengthen our prescription drug monitoring program, mandating greater use by prescribers, and upgrading technology to ensure that more prescribers can use it in a timely fashion. It's clear we need to provide additional law enforcement support to our hardest hit communities, similar to a grant-funded effort underway in Manchester, and to continue to address the backlog that we have in our state police forensic laboratory. We agree that we must require all of our medical boards to update prescribing practices to help stem the tide of new addictions. And we know we must also streamline access to treatment by requiring all insurance companies to use the same evaluation criteria and removing prior authorization requirements in certain cases. And though we have agreed to wait to take it up in the regular legislative session, we also know that we need to reauthorize as soon as possible our bipartisan healthcare expansion plan, which has already provided treatment services to thousands of Granite Staters, and it is the single most effective step we can take to increase treatment capacity in our state. Right now, that program is due to sunset or expire in January of 17. We've got treatment providers who want to invest the capital to expand treatment capacity, but until they know that we've reauthorized the program so that the federal dollars are there for reimbursement, they're holding off. So we're really pushing hard to get that done as quickly as possible. We also know that we need to continue working with our young people, as our New Hampshire Department of Education is doing, to help them understand the dangers of substance abuse. Each of these individual efforts is critical to combating this truly horrible epidemic, but we know that there is more work to do, and we're going to have to continue to fight together, each and every one of us, every single day, to build on our efforts to combat this crisis. From law enforcement officials, firefighters, and emergency medical workers, to families, people in recovery, and our business community, to our judicial system, medical providers, and healthcare workers, as states, as a region, and as a country. We are all in this together. It's going to be difficult, and it will require our constant vigilance and perseverance. But we will be successful because we're New Englanders, we're Americans, and we work together to do hard things. Thank you all so much for your interest and time this morning. I look forward to working with all of you.